Hi everybody, this is Michelle Cooper. I'm the Health Education Specialist here at PCADV. So a little bit to start, we just like to go over our objectives, and for today they're pretty simple. We're going to define traumatic brain injury, TBI. We're going to understand the connection between traumatic brain injury and intimate partner violence. And then we're going to learn how to use the HELPPS screening tool to work more comfortably with victims and survivors of domestic violence. So we're going to go through all of those things today. Really quickly, I always like to talk a little bit about self-care because, of course, as with most things that we talk about, these are pretty heavy subjects. So first things first, take some breaks as you need. You know, if you need to step out, of course, I won't know it if you do. So make sure that you're taking good care of yourself. Make some time to debrief. A lot of you are watching this webinar together. So, you know, if you have the opportunity to debrief together after the webinar and just talk about what you learned today, that's always a good idea. And of course, I'm always available if you want to talk, you know, set up some time to chat. That's part of why I'm here for everybody. Check in. So if you find yourself kind of zoning out, tapping your leg, things like that, chances are you need a break. And that's okay, but just make sure that, you know, if you need some time, take a couple breaths, go get a drink of water, and then come back and refocus. Don't worry about asking questions, always do. So if something comes up, like I said, you can ask in the chat box, you know, talk to each other. Although I will say, even though we're muting on our end, you may also want to make sure that you're muted on your end just to avoid any feedback or anything like that. So if you're asking questions to each other, make sure that you're on mute, which you should be. And finally, just don't forget to breathe, you guys. This is a long webinar with a lot of information, and it's really important to just take some time to check in, take a nice deep breath, and make sure that you're taking good care of yourself. All right? Onward and upward. We're going to start by learning the basics about traumatic brain injury. So, of course, a great place to start is, what does that mean? What do we mean when we say traumatic brain injury? Very simply, it's just a brain injury caused by external physical force that is not present at birth or degenerative. All right, so this is something that happens to someone. And these injuries can be either penetrating, so that would be a foreign object that enters through the skull and into the brain, damaging it. Thankfully, we don't tend to see a whole lot of that. Most often, what we deal with in our work are what are referred to as closed head injury. That's an external force that impacts the head but does not fracture the skull. Okay, so that's the basic definition of a traumatic brain injury, and we're going to talk a lot more about how that looks with regard to the clients that we work with. But first, we're going to start our poll questions. I want to get an idea of where everyone's at with regard to their knowledge about traumatic brain injury. So we're going to do a poll, and what I want to ask first is loss of consciousness necessary for a TBI to occur? And you can answer on behalf of everybody that's in there with you. Oh, that was quick. All right. So it looks like pretty much everybody so far is saying no. Is loss of consciousness necessary for a TBI to occur? Have some of you had this training before? All right. I know some of you are still answering, but in the interest of time, I'm going to jump back to the presentation and we'll see our answer. But many of you answered no. So let's see what it says here. Correct. Very good. No, loss of consciousness is an indicator of a more severe brain injury, but it is not necessary for brain injury to develop. So excellent job, everybody. All right, so our next question. Will additional head trauma make a brain injury worse? Will additional head trauma make a brain injury worse? It's got a couple maybes, some no's, mostly yes. Okay. Let's head on back to the PowerPoint here and see what our answer is here. Yes, very good. So pretty much everybody had the right answer for this one too. When there's another impact to the head, brain injuries can get worse and the rehabilitation process can be extended significantly. So excellent job. Once again, I'm beginning to suspect that some of you maybe have had this kind of training before. All right. Next question, can a traumatic brain injury be detected with an MRI or CAT scan? All right, looks like most of you are saying yes. We've got some maybes, we've got some no's, so a pretty mixed bag of answers here so far. Let's head back and see what the results are. By the way, just FYI, this is my first time doing a poll in a webinar, so it's very exciting for me. Thank you all for participating. Not always, so that was a trick question. So those of you that said maybe, excellent job. A mild TBI may not cause brain swelling or other changes to the brain that tests like an MRI and a CAT scan look for. And that's a really important thing to remember, and we're going to talk a lot more about that. But, you know, a very severe traumatic brain injury will show up because of the brain swelling and changes to the brain, but that's not always an indicator and certainly not the best indicator somebody has a traumatic brain injury. All right, final poll question. Are traumatic brain injuries usually discovered during routine exams? All right, most of you, looks like you're saying no. Let's go back and check the answer on that one. Here, no. All right, excellent. So most of you also have the correct answer for that. Traumatic brain injury is often unreported or misdiagnosed, and that's usually due to imprecise information gathering or and/or a lack of recognition by healthcare providers. So excellent job, everybody. You really have a good baseline understanding of this issue already, so that's great. So let's get into some details here. The first thing I always like to talk about quickly are the symptoms of traumatic brain injury, and you all have this up, so I'm not going to go through each one, but one of the things that I really like to talk about, and this will inform a little bit of why we do the HELPPS screening, which we'll get into in a little while, but a lot of these symptoms, when you look at them, seem like they should be fairly obvious, right? So things like altered gait, attention deficit, visual disturbances, balance problems, even things like seizures or nausea. When we look at those, it seems like those should be very obvious and apparent to us, but the thing to remember is that these are not always going to be dramatic and noticeable symptoms, which is why it's really important for us to talk to our clients about what their experience is. Because altered gait, for example, when we hear that, we think of somebody that has very visible trouble walking. But what that actually looks like when somebody has a traumatic brain injury is that they may feel like they're not able to walk as well as they used to. Their gait may be fine to you. It may look normal. It may look like they're doing fine, but to them they may just say something feels off, or I used to be able to, you know, walk back and forth down the hallway with no problem, and now I feel like I kind of have to lean against the wall a little bit sometimes. Things like nausea, things like balance problems, even things like seizures, which may not always be the kind of seizures that we expect to see, where people, you know, kind of I call it the made-for-TV movie version, where somebody very dramatically seizes up, and you know, a seizure can sometimes just be somebody looking like they're spacing out for a little while. We call that a catatonic seizure. So these symptoms are really important to ask about, which is why we use the HELPPS screening tool, because they're not necessarily going to be evident to us, and they may not be evident to the person that we're talking to as a symptom of a traumatic brain injury. They may feel like maybe they're just coming down with something, or they're just really tired, or they may associate it with some other kind of illness that's either diagnosed or undiagnosed. So understand that these symptoms are different for everyone. They're going to manifest different for everyone. And then very specifically, if we look at these bolded symptoms, there's something really important about them. They're all symptoms of post-traumatic stress disorder in addition to traumatic brain injury. So things like disorientation, insomnia, emotional instability, anxiety, depression, poor memory or concentration, these are all things that are often associated with post-traumatic stress disorder. Sometimes they're even symptoms that may be medicated. And we know that a lot of the individuals that we work with, the victims and survivors that come through our programs, are experiencing post-traumatic stress disorder. So this is the main thing that they present with, but these are also indications that they may have a traumatic brain injury. And because we know that these are not often diagnosed in regular medical exams, they may not be things that our clients are familiar with. They're going to get misdiagnosed sometimes or diagnosed as post-traumatic stress disorder. And a really important thing to remember about that is that this can create conflicting symptoms that mimic some very severe mental health disorders like bipolar disorder and depression. So survivors of domestic violence are at a high risk for misdiagnosis, as PTSD and traumatic brain injuries often co-occur with each other. So this is another reason why, as advocates, we go through the HELPPS screening tools so that we can help start a conversation about this and hopefully help our survivors at least identify if this is something that they're at risk for so that they can get access to resources that they may need. But the PTSD and traumatic brain injury connection is a really significant one because both of these, as you're going to see, are pretty prevalent amongst the survivors that we work with. I want to take a couple minutes to talk specifically about strangulation because while 68% of our survivors experience this as a method of violence, only about 20% disclose it. So the reasons for that are pretty significant. A lot of times they don't associate strangulation with a physical assault. Other injuries might seem more significant than strangulation. There may not have been a loss of consciousness, and sometimes they don't feel like if consciousness wasn't lost, it's not something that they need to worry about. But most often, it's because people don't ask them if it happened. This can be a pretty shameful thing that happens to someone. If it was a severe case of strangulation and they did lose consciousness, they may have also lost control of bowel or bladder function. And, so this is something that it's really important that we talk about because strangulation disrupts the blood flow to the brain, disrupts oxygen flow to the brain, and it can cause, in addition to traumatic brain injury, people that experience strangulation, even a small amount of pressure to the neck can create certain risk factors that make them more susceptible to things like stroke as well as traumatic brain injury. So this is an aspect of TBI that I could sit here and talk about for the rest of our time together, but I won't. But please understand that this is something that we should be asking about also. And we do this with our lethality assessment, but we don't always do this when we're talking about traumatic brain injury, and it's important that we do, or at least when somebody discloses strangulation, we understand that that is a form of traumatic brain injury and it can cause the same impact that a blow to the head might. All right, so we're going to move on now to sort of the connection between traumatic brain injury and intimate partner violence, and I want to start by kind of reviewing the causes. Now, obviously, this is not, an exhaustive list, but most frequently, causes of traumatic brain injury among survivors of intimate partner violence are being hit on the head, having their head slammed on a floor, wall, sidewalk, or other hard surface, being shaken, being pushed or thrown, being shot or stabbed in the head, which would account for the penetrating injury to the brain, and then losing oxygen through strangulation, asphyxiation, or attempted drowning. Something really important to remember with regard to all of these is that most of the time they're not occurring in singularity. So for example, being hit on the head and then being pushed or thrown, being strangled and shaken. So a lot of these things are things that will exacerbate existing traumatic brain injuries, or even if it's one incident, it can contain a lot of different physical assaults that can cause and make worse a traumatic brain injury. These are some statistics, and this is a full disclosure for all of you. These are taken from a study. I know that the study was done. It's in the Traumatic Brain Injury Training Toolkit, but I have not been able to find the information about the study. So I know that it happened, but I want everybody to be, this is just full disclosure that I can't give you the exact shelters that were interviewed for this particular statistic. So just know that. But there were 3 shelters, I believe, in New York State that were asked about, the survivors there and their experiences with traumatic brain injury. And about 36% of those survivors had sustained injuries to the head, neck, or face at some point. 92% had been hit on the head, most often more than one time. 83% had been hit and also shaken, so that's kind of what we talked about in the previous slide. And then 8% had been hit more than 20 times in the past year. And so we know that this is an issue. This was just a snapshot of a couple different shelters, but I think for any of you that are doing your regular HELPPS screening, you know that this is stuff that happens often. These are not incidents that happen every once in a while. A majority of survivors have experienced some form of physical violence, and because of the tendency to avoid visible marks, abusers will often violently shake or hit their partners in the head as a way to, have that physical abuse without leaving a bruise or noticeable mark. So these are things that are happening, and it's happening a lot. And my hope is that as we talk about this issue more and more, and we start to do more research just in general on the prevalence of traumatic brain injury, so we all hear about this all the time with regard to football, right? We know that now they're paying more close attention to how football players sustain traumatic brain injuries and the impact that that has on their long-term health. We also hear about this with regard to veterans of war that come home and have sustained brain injury. So there's statistics available on traumatic brain injury and its impact, and my hope is that we'll be able to start looking specifically at survivors of domestic violence, because we know that this impacts survivors at astronomical statistics. So hopefully we'll have data to back that up moving forward. So when it comes to our survivors, how can we start to recognize traumatic brain injury? Difficulty concentrating. Most frequently when you have an injury to the brain, it disrupts executive function and other parts of the brain that help you think about what you have to do and what order you have to do it in. And when you're trying to sit through a meeting or you're trying to get case management, you may have trouble kind of focusing on what it is that you were talking about or what it is that you're supposed to do. Poor memory. So another thing that happens when there's an injury to certain parts of the brain is that your ability to literally, for lack of a better word, code memory becomes disrupted. And so very often, your ability to remember what somebody asked you to do, to remember a detail from a story that you were telling, all of those things may be disrupted if there is a brain injury. Communication problems. So we talked a little bit in the symptoms slide about the fact that sometimes speech can be impacted, and that's because depending on where an injury is incurred, there can be an issue processing information, and that can go both ways. So you can have trouble receiving information. You can also have trouble putting out information. So you may know what you want to say, but then when it tries to come out of your mouth, it just doesn't come out the way that you want it to. And it's at this point of the presentation that when I do this in person, many people start saying, oh, I think I might have a brain injury, right? Because sometimes we all have that kind of inability to make what's happening in our brain come out through our mouth. But with somebody that has a brain injury, and especially a compounded brain injury, those communication problems can be really significant because they're having trouble with both things. They're having trouble receiving information, they're having trouble communicating what they need or want, and everything else in between is kind of jumbled up as well. So that all has to do with the next portion of the slide, which is compromised executive functioning, trouble processing information. And then finally, they can have changes in their personality. And this is a tough one for people that are working with survivors, because we just met these individuals. So we may not know if their personality is different. We may not know that usually they're a very exuberant, outgoing, bubbly person, and some of that has to do with experiencing trauma, but it also sometimes has to do with the fact that a traumatic brain injury, you can imagine if your executive function is compromised, you're not able to process information the way that you used to, you're having trouble remembering details, you're going to start to feel frustrated. You're going to start to feel like you're not yourself. And that can definitely start to impact somebody's personality, the way that they interact with other people. But also, very specifically, there can be changes in personality that have to do with that brain injury. So things like depression, things like insomnia and sleeplessness can also have a serious impact on somebody's personality. But because we wouldn't know that, it's very important to use tools like the HELPPS screening tool in order to start to help that individual identify that there might be an issue and help us understand what that issue might be or look like. So that brings us to the next portion of the presentation, which is screening, right? You have this tool that we've asked you to use, and now we're going to talk a little bit more about how to use it and why it's important. And hopefully by now all of you kind of have a good idea of why it's important and how you might be able to start using it a little bit more often in your regular interaction with clients, not just as part of your intake process necessarily. But first, I think it's really important to understand what TBI screening and programs is actually all about. Why is it so important beyond helping to connect them to resources? So first and foremost, right, at the top here, we see it can alert the survivor to the possibility of a traumatic brain injury and a need for medical assessment. Now, that's not always going to be the case. They may not always want to have a medical assessment done, but when we do a screening with our clients, that helps them make a choice about their health that's really important. And I'm going to reiterate this probably a lot, but the HELPPS screening tool isn't a clinical tool. You're not a clinician. This isn't something that you're using to diagnose a traumatic brain injury. This is a tool that's helpful for you to understand better how to interact with the survivors that you're working with, and most importantly, it's a tool for the survivor to start helping them understand that this may or may not be an issue, but that they have options if they feel like it's something that they want to look into. TBI screening provides staff with information on how to best work with survivors, and we're going to talk about that a lot at the end of this presentation. But one of the things that I think a lot of programs don't know about, unless you're a medical advocate, at which point you probably should by now know this, unless you're new, is that Pennsylvania has a head injury program. And if somebody has a traumatic brain injury and they have a medical assessment done and it indicates that traumatic brain injury, they can be eligible for the head injury program through the Pennsylvania Department of Health. And one of the things that you can do as a direct service provider or case manager is to help them with their application for assistance, because that way the survivor can be eligible for some things that might help them while they're rehabilitating from a traumatic brain injury. Things like assistance with getting to and from work, assistance with finding employment if their brain injury is impacting their ability to do so, and other connections and access to medical assistance that can really help them in their recovery. So that HIP program is a really important resource for you to know, and I do have a slide at the end of this presentation with the website so that you can access it if you're not familiar. And of course, as you know, you can always just email me as well. So what happens if TBI continues to be undiagnosed? In a nutshell, it really impacts the positive outcomes that our clients can have when they're receiving our services. If they're undiagnosed and if they're not able to concentrate and if they're having issues remembering things and if they're not feeling like themselves and their personality is impacted, and if they're having some of those more physical reactions to traumatic brain injury, like their stamina is different. Maybe they're having seizures, but they don't realize that that's what's going on. That can really impact their ability to get the most out of our programs and the most out of the services that we have to offer. It also compromises effective rehabilitation because, as we talked about, very often this isn't something that has occurred just one time. So if they've been hit in the head more than one time, if they've had more than one traumatic brain injury that's gone undiagnosed, they're not going to be able to effectively rehabilitate because they're not connected with any resources that are going to help them do that, and they're not modifying their own self-care in a way that's going to help their brain start to rehabilitate and recover. And that's going to impact them fulfilling their personal goals. So when people come into shelter, You know, a lot of times there's things that they want to try and achieve while they have that extra help and support. And an undiagnosed traumatic brain injury can really compromise their ability to do that. There's all kinds of reasons why that's not great. But first and foremost, it's impactful to their self-esteem and their ability to feel empowered, which is the main reason that we're here to help our clients, is to empower them and help them move forward in a way that's going to give them independence and help them to take care of their own needs in a way that's healthy. And if they have a traumatic brain injury that hasn't been addressed or diagnosed, that can really impact their ability to do so. So when we talk about using that HELPPS screening tool, that's why we want you to be doing this at intake every time. Not only does that remove stigma, right, because we're not really talking about traumatic brain injuries. We may talk about it amongst ourselves in the domestic violence advocacy movement, but it's certainly not something that many people outside of this movement know about. And even amongst us, you know, I can see how many advocates are here taking the training today, which means that even amongst our programs, this is an issue that, you know, we should probably be talking about a little bit more. And sometimes when people have a traumatic brain injury, they feel a little bit self-conscious about it, or we may feel self-conscious asking about it, because some of the things that we need to ask about with regard to strangulation, you know, with regard to, you know, being hit, these are things that are difficult to talk about. And a lot of times people don't realize that those are things that can cause or exacerbate a traumatic brain injury. So by asking everybody every time in the same way, you really remove the stigma about having the conversation and you normalize this process. And not only does that help us identify more potential traumatic brain injuries and risks for traumatic brain injury, it also provides education for everybody on how prevalent this issue is. So maybe not everybody is experiencing this. Maybe not everybody has even had an experience that might have caused or exacerbated a traumatic brain injury. But when we talk about it with everyone, we start to really generate the understanding that this really is a very serious health risk for victims and survivors of intimate partner violence. It's at epidemic levels. And the more we talk about it with each other and with our clients, the more we can start to normalize it and make sure that everybody that needs help has access to help. So that's why we really recommend that this is just something that you do with every client that you see. And the more comfortable you become with it, the easier it becomes. And I know that adding one more thing to the list of things to do during intake can seem really daunting. But once you start doing it, just like anything else, once you get comfortable asking the questions in a conversational way, this just becomes another part of your process, and it becomes natural. And so the more you do it, the better it'll become, right? the easier it'll get. Some quick guidelines, and these are things that I'm sure all of you are very aware of, but I just like to always point them out. That when we do our screenings for anything, whether it's intimate partner violence, whether it's with our intakes, in this case with our HELPPS screening tool, we want to make sure that the screening process is empathetic, first and foremost, right? So we're not going down this checklist, you know, just kind of asking very, you know, directly, did you do this, did you do this, did you do this, right? We're using empathy because these are not things that people love talking about. These are not questions that are easy necessarily for people to answer. So when we ask these questions in an empathetic way, when we do this in a conversational way, that really makes the screening process a lot easier and more trauma-informed for both of us, right? For the person that's administering the screening and for the person that's being asked these questions. Conducted within legal parameters just means that we're asking these questions in a respectful way, and then we're going to talk about what to do with your screening tool. Hint, don't keep it in your client file. So we're going to talk about that more. But most importantly, we want to make sure that we're not keeping this screening tool. This belongs to survivors, and we'll talk about that more in a minute. We want to make sure that the screening process isn't stressful. You know, our job is not to stress people out. This is something that's incredibly helpful and important, and we want it to be as easy as possible to have these conversations and to do this screening. We want it to be culturally competent, so many of you have asked me for a Spanish version of the HELPPS screening tool, and I do have one that I received when I first started working here at PCADV back in November. So I will try and get that out to everyone to make sure that you have a copy of the screening tool in Spanish if you need it, and then making sure that your screening process is always inclusive. So making sure that when you're speaking to people that identify as LGBTQ+, trans, you're using pronouns that are appropriate, that you're asking what someone's pronouns are, and that you're just being inclusive and making sure that this process is comfortable and non-stressful for everybody. So the big reveal, right? The actual tool, and I'm hopeful that all of you have seen the screening tool and that you have access to it, but if anybody taking the training today does not, for some reason, have this, it will be an appendix in the back of the PCADV standards, but I am also happy to share it with you if you send me an email. So really quickly, we're going to go through some of these questions, and then we're going to take some time to go into them in a little bit more detail. But the HELPPS is, stands for HIT. So the first question is, have you ever hit your head or been hit in the head? And you'll notice that we ask this, in a very generalized way, because this doesn't necessarily have to be something that was a result of a physical assault or a domestic violence situation. If they've ever hit their head before, they're still at risk for a traumatic brain injury, and it's something that it's really important for us to be able to identify. We're also going to ask if they were ever seen in the emergency room or hospitalized, because sometimes if there's been a physical assault and somebody was hit on the head and they were seen in the emergency room, that means that that was probably a more severe injury, and there's probably more of an indication of a brain injury or severe brain injury. And there may have even been an indicator of that if they went to the hospital. They may have said, oh yeah, I forgot, but I did go to the emergency room and they did say that, I may have a concussion or something like that. The other reason we ask about this is because some of those symptoms and side effects that we talked about with traumatic brain injury can end in an emergency room visit. So maybe the assault happened, they were strangled and pushed so that they hit their head. Maybe they didn't lose consciousness, but maybe a couple days later they started feeling really sick. Maybe a couple days later they felt really nauseous and they couldn't catch their balance. They had vertigo, and so they went to the emergency room for that. They may not really associate those two things, and when they went to the emergency room, they may not have said, oh, I hit my head a couple days ago and now I'm feeling nauseous. So this is a way for us to start kind of putting those puzzle pieces together to determine if maybe that emergency room visit was because they had a head injury that caused these other symptoms. So we always want to ask, if they were in the emergency room or hospitalized, what reason? Because that'll kind of help us figure out or determine if maybe that was, a side effect of a traumatic brain injury, or because there was a hit to the head that was particularly severe. Obviously, it's really important to ask about loss of consciousness. We want to ask if they did lose consciousness, and if so, for how long and for what reason. So once again, we're keeping these questions very broad. We're not making an assumption that because they were hit on the head, they lost consciousness. The loss of consciousness may have happened for a different reason. Perhaps they answered yes to the hit on the head, and then they say, oh, I did lose consciousness at a different time because my partner put his hands on my throat and I lost consciousness for a few minutes. They may not even associate that with a potential traumatic brain injury, but now we know that there's two incidents that may have caused or exacerbated a TBI. And then we're going to just ask about general problems. Did you have any problems after you were hit on the head? Now, obviously, if they said, no, I've never been hit on the head before, we're not going to ask if you had any problems after you were hit on the head, right? We're going to use our common sense with this one. But they may have said, yeah, I lost consciousness because of strangulation. And so then we might change that question a little bit to say, did you have any problems after you lost consciousness because of strangulation? So we're going to modify this in a conversational way as needed. And those problems, once again, go back to all of those symptoms that we talked about that can indicate a traumatic brain injury. So if they had any problems with their speech, problems with their memory, problems with feeling like they had, the same kind of hand-eye coordination or ability to walk that they used to. This is where we get into that kind of conversation that allows for self-disclosure so that they can tell us, you know what, ever since this incident, I really haven't been feeling right. I can't explain it, but I've just been really tired, and sometimes I have to put my head down when I'm walking down the hallway. I just start to feel kind of dizzy or weird, right? This allows them to kind of start having a conversation about it. Pregnancy, is there any chance you may be pregnant? I think you guys can probably figure this one out, but I'm just going to say for posterity, pregnancy does not mean that somebody has a traumatic brain injury. We put this question in here, and we're going to talk about this in the next couple of slides, because there are a lot of risks associated with pregnancy and traumatic brain injury. So this kind of messes up our scoring system a little bit, because if somebody says, I was in the emergency room because I was feeling nauseous because I'm pregnant, technically that's an answer of 2, but obviously that doesn't automatically mean that they're at risk for a traumatic brain injury. So this is another time that we kind of have to use common sense and our best judgment. But we want to ask about pregnancy here if they have been hit on the head, if they have been hospitalized for an injury, if they have been having problems, because we know that traumatic brain injury can be very impactful during and after pregnancy. So that's why that extra P is in there. And then finally, we're going to ask about sicknesses. So if they disclose that they've been hit on the head, if they disclose that they had some issues, then we're going to ask if they've had any significant sicknesses, because that's going to help. That's going to go back to those symptoms and problems that are indicative of, a more severe brain injury, and some of those side effects that mirror things like the flu or other illnesses like that. So nausea, dizziness, stuff like that. So that's why we ask specifically about sicknesses, and that's why sicknesses and problems are distinct from each other. So really quickly, and if you all have questions about the HELPPS screening tool, you can enter them in the chat, or you can write them down and we can talk about them at the end of the webinar. I hope I did a pretty good job of kind of going through that in a way that helps you understand why we ask all those questions and how to ask them, but I'm happy to kind of go over that in more detail with you if that's something that you need at the end of the webinar. But moving on to the pregnancy. Pregnancy isn't a risk factor for traumatic brain injury. I'm going to reiterate that one more time. Specific health concerns can make it really important to screen. Trauma is the leading cause of non-obstetric maternal death, so the risk of physical assault escalation during pregnancy is really high. And those of you who have been doing DV 101 trainings, this is kind of common knowledge, but we know that reproductive coercion is a pretty prevalent tactic. Individuals that will get their partner pregnant on purpose and then become really possessive and controlling when that pregnancy starts to actually manifest, because it's taking attention away from them. And so, also when somebody becomes pregnant, they're getting a lot of attention, they're going to the doctor, hopefully the doctor's doing their IPV screening and asking if they feel safe at home, so all of a sudden this pregnancy becomes a threat. And so we know that pregnancy can really escalate existing unhealthy behavior in a relationship, and that can escalate to physical trauma. Strangulation and physical assault can also impact the fetus. So there's 2 things that are particularly significant: maternal shock, which is inadequate supply of oxygenated blood to the tissue. And that can happen a lot, when there's a severe injury, strangulation, things like that. And then placental abruption, which is the separation of the placenta from the uterus. So those are 2 things that happen during strangulation and physical assault that are directly impactful of the fetus. And so when we're doing that HELPPS screening and somebody says, yeah, I was hit, or yeah, there was strangulation, or whatever they might choose to disclose, and they're pregnant, we know that that's going to give us some different resources medically that we're going to want to connect that individual to. The other thing is that TBI can exacerbate postpartum difficulties in much the same way that we know that it can exacerbate post-traumatic stress disorder difficulties. So depression, increased fatigue, and trouble multitasking. So in addition to exacerbating, postpartum depression, which is something that I think we often associate in general with pregnancy risk, also just the increased fatigue and trouble multitasking when you have a mild brain injury can make it really challenging as a new mom. So just understand that that's why we include that question, and if they are pregnant and experiencing risk for TBI, we want to make sure that we are aware of these issues and can get them connected to maternal health resources that can help them, just make sure that mom and baby are both safe. So that's why that extra P is in there. The other thing, and this is kind of a reiteration of what we just talked about, but 31% of maternal injury deaths can be attributed to IPV, so this is definitely significant. And we already talked about the reasons why survivors experience escalation, but other health issues that can contribute with brain injury and other physical assault during pregnancy are preterm delivery, low birth weight, high blood pressure, and kidney infections and UTI. And all of those are just because mom is stressed out. And when you're creating more stress hormones during pregnancy, that's going to create more health impact for mom and baby. So that's why this is a really important thing to remember to ask about in that screening. So when you're doing your HELPPS screening, we've talked a lot about how to do it. We've talked a lot about what the questions mean. But we also talked about connecting that individual to resources depending on their answers to those screening questions. And once again, it's not a clinical tool, so we're not saying you scored 4, you definitely have a brain injury, right? We're going to then talk to them about their risk, and we're going to offer some resources. So some of those next steps might be recommending that they have a medical assessment. So you want to look for somebody that can assess them, and usually that's going to be a neurologist. And you're going to want to make sure that that neurologist understands that, they want an assessment for a mild traumatic brain injury. So like we talked about before, an MRI or a CAT scan may not be enough to indicate that there's an existing traumatic brain injury. So we want to make sure that we have a connection to specialists that can administer some other kind of testing to indicate if a mild to severe brain injury is present. But the medical assessment not only is important for the health of the survivor, it will also help get them connected to that HIP program. So if the medical assessment indicates a traumatic brain injury, that's when they'll be eligible for the head injury program. You can also help them call the brain injury hotline. So if you don't have a connection to a neurologist somewhere nearby, you can get them connected to the brain injury hotline, and I will share that number with you at the end of the webinar. That can help them get connected to someone that might be able to do an effective medical assessment. And that's also a way that you can get them connected to the head injury program. So the next thing that you might be able to do with them, if you do that referral and they do have a medical assessment that indicates traumatic brain injury, you can help them with their HIP application, because that can be kind of an extensive, it's a lot of finding the website and downloading paperwork and all of the stuff that all of you that do direct service are already very aware of. So you can help them with their HIP application if that's something that they might be eligible for. You can also help get them connected to somebody that can do rehabilitation. So we know that a brain injury isn't something that you necessarily recover or heal from, but you learn how to rehabilitate. The brain is resilient, and with proper rehabilitation, brain function can recover, and if it doesn't come back exactly the same way, brain can be taught how to accommodate for the injuries that it's incurred. But proper rehabilitation is necessary for that to happen, and if it doesn't, those compounded injuries can start to impact other areas of the survivor's life, like we kind of talked about, poor memory, personality changes, and things like that. And then, next steps are going to include case management that's TBI supportive, and we're going to talk a lot about that next. And I'm going to tell you guys a secret. Case management that's TBI supportive is really just trauma-informed case management. So even if somebody isn't really screening in, these are case management suggestions that are going to be helpful for just about everybody, because if they're not experiencing a traumatic brain injury, they're probably experiencing the impact of trauma, which really has a lot of the same symptoms and side effects that a traumatic brain injury does in some ways. So these are case management tips that are going to be helpful no matter what. but in particular for somebody that's experiencing a TBI, even if they're not interested in connection to resources or medical assessment, this is going to help you work with them more effectively, so that they're getting the most out of their time with you. So I said that I would probably repeat this a couple of times, so this is repetition number 2. Screening forms should never, ever, ever, ever be kept in client files. So please don't forget that, because it's really important. That HELPPS screening tool, you can review it with the survivor, and if the survivor wishes to keep it, that's fine. They can do that because, as we mentioned, if they're at risk for a traumatic brain injury, they may have some memory problems. So being able to kind of document some of that stuff, if you choose to, on the HELPPS screening tool can then be given to the survivor to take with them. If they're getting a medical assessment, it can help them remember to have a conversation that includes certain aspects of the screening. So, I need to remember to tell them that I was hit on the head and experienced strangulation, and here's some of the symptoms that I had. I was nauseous, I felt a little dizzy, and I felt like I needed to go to the emergency room. All of that stuff can be documented on that screening tool and then given to the survivor, and they can keep it. As with anything that we give to survivors, we want to go over, confidentiality, safety planning, making sure that they keep that in a safe place. But that safe place should not be their client file. So make sure that if they're taking it with them, they have a safe place for it. And if for some reason you need to keep it, which you shouldn't, it should be someplace separate. It should not be in their client file. If the survivor doesn't wish to keep it, then the form can be shredded, and you can just document that you did the HELPPS screening, but you should not be hanging on to that tool. And it looks like we have a question about the brain injury hotline number by Tim. Tim, that's going to be at the end of the presentation. It'll be at one of the last slides, so we'll get it to you that way. Okay, so HELPPS reminders, don't keep it in clients' files. Either give it to the survivor or shred it, okay? But we're going to talk about TBI supportive case management. And the first thing that I want to remember, or I want you all to remember, is that there's some results of living with a compounding TBI. So when somebody has a traumatic brain injury, or particularly if they have had one injury and then another and then another and then another, so they kind of build on each other before the brain has a chance to really rehabilitate or recover, they're going to have difficulty remembering or learning new information, okay? So that executive function, right, has been compromised, so they're not necessarily going to remember everything that you talk about, and they're going to have difficulty learning new things. So you may go over with them a couple of times, here's what you need to do to access the brain injury helpline, and they're going to nod and say okay, and then they're going to walk out the door and they're going to go, oh, I can't really remember what they said, which I'm sure sounds completely unfamiliar to all of you. So remember that. Survivors live with this kind of an issue, and this is also something that happens to people that have experienced trauma. They have difficulty acclimating to new situations because, once again, their ability to process information is compromised. So learning new information doesn't just mean learning a new skill or paying attention during a conversation. It also means learning how to acclimate to a new situation. They're coming into shelter, all of a sudden there's some rules that they have to remember. They're in a new environment. They have to remember curfew if there is one. They have to remember where their room is. They may have a lot of trouble acclimating to that, and they're not necessarily going to understand the reasons why they're having trouble acclimating to that. So you as a case manager or direct service provider, it's helpful to use that HELPPS screening tool to say, all right, we had this conversation. I think that there's a good chance that this person may have a traumatic brain injury or a risk for one, and they're having a lot of trouble acclimating here at shelter. Maybe that's because their brain injury is preventing them from really processing this new information, and so that's something to bear in mind. They may have poor judgment and decision-making abilities, so once again, different parts of the brain are responsible for things like decision-making, and if you have compromised brain function, those things aren't going to happen easily for you. So sometimes you're going to decide at the last minute, you know what, I'm not going to go to my case management appointment. I'm gonna go sit outside for an extra 5 minutes instead, or I'm gonna go, hang out with this person that I just met, and instead of, coming into shelter at curfew. Sometimes those poor decision making and poor judgment, that has absolutely everything to do with compromised brain function, and it's not because somebody is just being obstinate or doesn't want to abide by the rules. So that's an important thing to remember. They may lack awareness of post-TBI difficulties. So we kind of talked about this a lot, but just because they're experiencing, some issues with memory, motor skill problems with speech and stuff like that, they're also experiencing trauma. So they may not even be aware that they're having these issues, which is another reason why doing the screening is really important, because it starts the conversation and it helps you as an advocate, even if they're not really thinking about the fact that they may have a brain injury, you can be thinking about it, and you can be administering, direct service and case management in a way that's going to be most helpful to them. And then finally, they may be inconsistent, because once again, when the brain is compromised, everything else is compromised too. So their ability to, follow through on things, their ability to even be able to participate in things like group or conversations in a way that they're used to, they may be really inconsistent with that because, one night they got enough sleep and now their brain had a chance to kind of recover a little bit and they're feeling a little bit better, but then the next night they don't get a lot of sleep and now they're foggy, they're not really able to think as clearly, and so they may be, very different from one day to the next. Once again, it's also something that we see with people that have experienced trauma. So I think you guys are probably starting to to get the point here that, like everything else, all of these things are connected. But in particular, if you take all of those trauma experiences and then add a traumatic brain injury on top, all of this stuff is going to be exacerbated even more. So what do? Well, we do TBI supportive case management. So what does that look like? That looks like minimizing distractions during conversation. So I don't know about you, but when I did direct service, sometimes I would be in the only room available in shelter, and that room had kids running in and out of it, and the TV was on and kind of, in the background a little bit, and there were all kinds of things going on. And that can be really distracting on a good day to somebody that isn't experiencing the impact of a brain injury. So if somebody is, those things are going to be even more distracting. So whenever possible, we're going to minimize distractions the best we can. If the only room that we have to use is the room with the TV in it, make sure the TV's off. Try to make sure that there's not going to be a lot of people in and out, and if there are interruptions, make sure that you don't continue to try and have an important conversation. Wait until the distraction is over. Wait until the kid runs through the room or somebody comes in to ask a question, and then resume what you were talking about. Don't try to power through distractions, because when brain function is compromised, the distraction's going to win, always. Keep your meetings short and take a lot of breaks. So, and once again, this is kind of best practice for case management in general, but especially if there's a lot of information that you have to do it in little bites. And make sure that if there is a lot that you need to go over with a client, and we see this during intake a lot, that you're just able to each thing, cover it, and then take a little break. Say, hey, why don't you, take 5 minutes, take a walk, and then we'll come back and we'll talk about the next thing. We don't want to overload individuals with a ton of information, because we know that not all of it is going to be able to be contained in a brain that's compromised to begin with. Really encourage the survivors that you work with to keep a journal, to make lists, and to use calendars. And this is something that I encourage you to do in case management in particular, is to, and if you have access, and I know that sometimes you have people in your community that are going to say, is there anything I can donate to the shelter? Ask if they can donate journals and day planners, because this is something that's going to be really helpful. And I know a lot of times people are like, oh, I'm just going to use my phone. And that's fine, but for somebody that's experiencing brain injury, the process of sitting and writing things down can really help with rehabilitation of the brain, and it's also just another way for the brain to code information. So rather than just telling them something or entering it into a phone, you can also, it's a different part of the brain that takes care of, holding a pencil, writing something down. So journaling, making lists, and using calendars manually can really help them with their brain injury recovery, and it's also a good process to get them in a habit of, because if they start writing things down and they keep writing things down, that's going to help them with their with memory and things like that, especially if there's a really important date, like if they have court or if they have to meet with an outside caseworker, children, youth, and family representative, things like that. Sit with them and really make sure that they're writing things down, and whenever possible follow up, because once again their ability to kind of code memory is going to be impacted. Always speak slowly and repeat important information. So I have modeled this throughout this training by repeating the most important information, which is don't store your HELPPS screening tool in your client file, right? And that's important to practice with survivors that may have a traumatic brain injury too. If something's really important, make sure that you speak slowly, make sure that it doesn't get lost in the conversation, and repeat it. And if it's really important, help them write it down somewhere where they'll remember. Focus on one thing at a time. I know this can be really challenging, but when we're working with somebody who may have a brain injury, focus is really important because they're not going to be able to do that as well on their own. So it's up to us to model that and provide assistance. Really avoid going off on tangents. If you're talking about something important, hey, you have to be in court, the courthouse is down here, oh, by the way, there's a really great coffee shop around the corner. If you want to stop in for coffee, it's really awesome. But anyway, your court appointment is at this time, right? That conversation is not going to work for somebody. It's not going to work for many people, but especially somebody that has a potential TBI. They're not going to remember anything except maybe there might be a place that they can get coffee, they think. So focus on the important information. This is where the courthouse is. This is what time your appointment is. This is what you need to bring with you. And then go back and repeat it and write down the most important stuff, and don't deviate from the most important information. Once again, write important information down. So help them remember to do that, but model that as well. And if there's something that you're working on together, you can also make sure that you're writing it down and making sure that you remember to remind them, because that's one of the things that we can really do that's helpful for someone that may have a TBI, is to empower them to remember, but to also remember ourselves, because if we expect them to remember too many things, we're setting them up for failure. And remember those slides before that talked about how a traumatic brain injury can impact those good outcomes. This is one of those ways, by expecting them to remember too much on their own. So we can be helpful in that way too. You can assist the survivor in prioritizing by creating a step-by-step action plan. And that's something that if you're familiar with action planning, you can do. A lot of our goal plans with case management include this, but assisting them in prioritizing what they need to do first is really important. Executive function of the brain has to do with sequential ordering of things. So first I have to go to the grocery store, then I have to go to the dry cleaner, then I have to pick the kids up from school. That isn't always going to work for someone that has a brain injury. Sequential thinking can sometimes be disrupted. So you can really help out by sitting down and just prioritizing. If a survivor has a really busy day, sitting down and saying, okay, let's make an action plan for the day. Let's talk about what you need to do first, what you need to do second, so on and so forth. Provide meeting environments with low lighting and limited background noise. So this kind of goes back to the first thing that we talked about, which is minimizing distraction, especially things like, overhead lighting. And sometimes if you have a brain injury or just particular sensitivity, even the noise of a fluorescent light can be really distracting. So low lighting, limited background noise, and if worse comes to worse, ask the survivor, say, hey, is this environment comfortable for you? is the light a little too bright? How can I make things more comfortable? Because, what's comfortable to you may not be to them, but definitely bright lighting can be really distracting. So try and provide an environment where you can adjust the lighting as needed. And provide reassurance, education, and structure. And these are things that, we're already doing with our clients, but particularly when somebody's experiencing a traumatic brain injury, they're not feeling good about themselves. They're not feeling like themselves. And they may get really frustrated. Oh, I don't know what's wrong with me. I used to be able to remember everything. I used to be able to multitask. Now I feel like I can't do anything. So reassuring them that, hey, if they have a diagnosis of a traumatic brain injury, then gently remind them, hey, you're doing really well for somebody that's recovering from brain injury. Let me help you with this. Educating everybody, like we talked about, on brain injury, what it is, how it can impact you, and always creating structure. And we do this anyway in case management, but in particular for somebody that may have a brain injury, doing those things like helping them with step-by-step guidelines, action planning, writing things down on a calendar. You wouldn't believe how much of a difference these small things can make to somebody and how this can really improve their outcomes with regard to their engagement with our programs. So, in closing, some final thoughts. TBIs are extremely prevalent among survivors of intimate partner violence, which is why we want you to be doing these screenings with everyone that comes through the door, because we just know that this is something that's happening a lot, and it's happening to more of our survivors than we probably think. So doing the screening and assessing, if they need help and resources is one of the most helpful things that we can do to maintain and promote good health amongst our clients. Using the HELPPS screening method can help survivors decide if they're at risk and connect to the resources they need. So once again, this screening tool and screening method isn't clinical. You're not clinicians and you're not making a diagnosis. But it is a tool that can help the survivor start to understand what their risk may be, and that can allow you to help them connect to whatever resources are available in the community. The HELPPS screening tool assists advocates in creating an environment in which survivors with a potential TBI can thrive. And we talked all about this with good case management skills, with an understanding of traumatic brain injury risk yourselves. You're going to be able to really lift your clients up and help them succeed as they're working through your programs. And finally, screening every survivor every time normalizes the conversation and raises general awareness of traumatic brain injury and all of the related health issues that come along with it. So those are the things that I want to leave you with. And also, don't keep your HELPPS screening tools in your client files. So now is the time when I want to open it up to you for questions, and I realize that we're already 12 minutes over when we kind of said we were going to end. So, if you don't have questions and you need to leave the webinar now, that's fine. But before you do, while questions are coming in through the chat, I want to pull up the resource page. So this is going to have our brain injury, our helpline, which is 1-866-412-4755. And then there's some other things on here that I just thought would be valuable for some of you doing case management. The Department of Health Head Injury Program webpage is listed on here, and there's a link that you may not be able to access on this particular webinar screen, but you can download this PowerPoint, and also you can send me an email if you can't get it and I can send it to you. Another thing that you should be familiar with if you aren't already is the Office of Vocational Rehabilitation, or OVR. They can help if somebody has any kind of a disability or a diagnosis that may be preventing them from gaining employment, from getting to work, and can also help them get access to any kind of other assistance that they might need to make it easier for them to work if they have any kind of a disability or a limitation. So getting in contact with the Office of Vocational Rehabilitation if you're doing case management can be really helpful, not just for traumatic brain injury, but for all kinds of other things that our survivors may be experiencing. They can, for example, there was an individual that I worked with that had limitations with sight. It wasn't blindness, but there was a degenerative disease that was really impacting their ability to be able to drive. And Office of Vocational Rehabilitation was able to connect that person with rides to and from work. So something just that simple, but really helpful. And finally, the National Resource Center for Traumatic Brain Injury website is here. And this is just a resource that I found on my own. It's a research-based website, so there's a lot of information on there just about research with regards to traumatic brain injury, statistics, and things like that. So if you're curious, you want to take a deeper dive into this subject, that's a really good place to go investigate. And then finally, this is my contact information. So we did a really, quick but deep dive into traumatic brain injury today, and I'm not seeing a whole lot of questions in the chat, so maybe you all had all of your questions answered, and that is awesome if that's the case. But if you feel like you have more questions and you just don't want to ask them now, or if you feel like your program could use additional training or technical assistance about traumatic brain injury or anything else related to healthcare, medical advocacy, things like that, please don't ever hesitate to call or send me an email, because I can always provide free training and technical assistance to all of our programs. You do not need to have medical advocacy program funding in order to get training and technical assistance from me about things that are related to medical advocacy or just healthcare related in general. Okay. That's all I've got for you. It looks like there aren't any questions here. So if you can, please do your evaluations. You can do that by clicking on this link right here to complete the evaluation forms. That would be really helpful for me, because that lets me know how I did. This training was helpful for you, and hopefully will help me also create more webinars and training resources for all of you. Before we say goodbye, I just want to thank all of you for being here. There's so many people on this webinar today, and I wish that I could be looking at your shining faces in person, but I'm really glad that so many people were interested in this training. So thank you for being here.